Hi everyone, I'm Dr. Julie Cavallario. I'm doing this recording today to tell you a little bit about the Master of Science of Athletic Training program that we have here at Old Dominion University. Taking the video from our athletic training laboratory, which is set up for both classroom and lab instruction. It's dedicated entirely to athletic training. Our students are given access to the room so that they can come in and practice skills when they need to. So I'm just going to give you a quick show of the facility so you can kind of see it. Sorry for the close-up here. So you can kind of see that we have down in front here, there's some space where we do some lecture and we have tables set up for lecture. And then on the back side of the room, we have treatment tables. And that actually continues beyond this wall right here and continues on to the other half of the room. So there's about 12 treatment tables for laboratory practice and room for 12 tables in the front of the room for seated lecture. So this is where we do the majority of our classes. For those of you who don't know, athletic training is a healthcare profession where we work to prevent, evaluate, treat, and manage injuries and conditions that commonly occur in an active population and return them to activity. Common places where athletic trainers work is high schools and colleges. It's about 40% of athletic trainers. Other settings for athletic trainers are in professional sports, industrial settings. So companies like Dominion Energy or Amazon hire athletic trainers to treat their workers to help reduce workers' compensation claims and other insurance costs, and performing arts and physician practice settings where athletic trainers might work with a physician to help provide care to patients within that physician's practice. So those are some of the most common settings where athletic trainers can be found and where they work. One of the unique aspects of athletic training, in my opinion, is it's one of the few healthcare professions where we go to where the patient is, as opposed to waiting for the patient to come to us for an appointment. So oftentimes you'll see athletic trainers on the sidelines of athletic activities, or right there in the presence of wherever the activity is occurring. So some unique things about our program. It is a graduate degree, and it is a 24-month continuous master's degree program. Students enter in the summer, they come summer, fall, spring, summer, fall, spring, graduating in the spring and being eligible to sit for the national certification exam, which is the national credentialing examination for athletic trainers to be allowed to practice and obtain licensure in whichever state they intend to practice. Each one of our students completes more than 30 weeks of immersive clinical education, which is time spent with an athletic trainer in whichever setting they work, under their supervision and actually performing hands-on care with patients. So most of our students really enjoy that aspect of the program, getting to actually apply skills to a patient and spending time with an athletic trainer and learning about the different settings in which they work. Some other unique aspects of our program include some supplemental clinical rotations where we have our students do some rotations through behavioral health facilities, physical therapy facilities, physician practice clinics, hospital organization settings. So just to give an opportunity to interact with other healthcare providers and figure out where athletic training fits with the overall healthcare team. Every one of our students receives a telehealth certification as a component of the program. And then one other aspect that's unique to our program is our research component. Every one of our students completes a research project. It's mentored by a faculty member. We start in their first fall, and it's a fall, spring course sequence, and we build in the research project into a research course each of those semesters. So the very first semester, the student will be working with their mentor to understand their project and content area and write an introduction. In the second semester of those courses, they will work to develop a method section of a manuscript and potentially collect some data. In the third semester, their data will be collected and they'll write a result section. And in the fourth semester, they will analyze the data and write up their discussion. So the goal at the end of the project, even though it's a master's degree, it's not considered a thesis because we don't do a traditional thesis document. The goal is that our students have a manuscript that is eligible to submit for publication should they choose to. Many of our students ultimately present at state or district conferences or conferences that are right here on the university and can apply for various writing and scholarship opportunities to earn funds to pay for school based on our organization, our athletic trainers organization at the state and district level. So those are some of the highlights of our program. I think that that's probably all the information that I'm going to give in this quick clip. But if you have more questions, you can always contact me. My email address is jcavalla@odu.edu. I hope to hear from you. And if you have any questions about our program, I'd love to talk about it with you.